Hello and welcome back to Bonninghausen's Academy. One more very interesting experience in the clinic which I would like to share. And this time this is a case of an acute migraine headache. This patient complains of a supraorbital pain which goes and extends to the vertex and then finally settles over to the right side of the occiput. And this pain would get worse shaking the head, worse lying on the right side. That means on the painful side, and it was better by a tight bandage. This was the complaint of the patient. And the headache was very severe and she was demanding for a quick relief. And in migraines, we need to remember that an acute attack of migraine will usually require an acute remedy covering the totality of the acute attack. So we took up these symptoms, and beyond our expectation, a very interesting remedy emerged, and that remedy was creosote. We have studied creosote as a female remedy. It belongs to the carbon group, and we know very little about this remedy. But there is something very, very interesting when I read through the head symptoms from the textbook, that means from Herring, and I could see the exact resemblance of the symptoms of the patient, and this was to my very pleasant surprise. This patient really improved immediately after a single dose of creosote, which I used first time in a case of a headache, a migraine. And the textbook proving writes it is suitable for chronic periodic headache. Now this is very important statement, that the provers and possibly a clinical symptom from Herring, that this is related to periodic headaches like migraine, like cluster headaches. And it says again, the nature of the headache in creosote, if you look at the symptoms carefully, you will find that these symptoms belong to a vascular congestion of the head and neuralgic headaches. So when we talk of vascular headache, it means there is blood that is gushing into the head, and the textbooks write as if the brain is going to be forced out of the forehead. There is throbbing and pulsating kind of pain. And the other kind of pain that we see is neuralgic pain. It is a tearing, drawing, jerking from the anterior part of the head, and it extends into the cheeks, the jaws, the teeth, into the neck. And books write semi-lateral headache. It is half the head. So one can also consider this remedy in situations like trigeminal neuralgia also, where the pain extends into the face and into the head. And the modalities are worse moving, worse lying on the pain-free side, and our patient said better with external bandage, means pressure, worse talking. And interestingly, another very important ailment from in creosote is that after a carousal means parting in noisy environment and taking a lot of alcohol. So the textbook also writes headache as if from intoxication. And two remedies that come to our mind when we understand this, when we look at this description, is that of belladonna and naxwamika. These are two very closely related remedies. Belladonna to its vascular part, naxwamika to its neuralgic part, and also the precipitating cause of carousal, alcohol, very important remedy. So this is a very interesting experience. I thought I must share it with all of you. If you like the video, do like it, do share it with your friends, and subscribe to our channel for some more. Every day we share these very interesting clinical anecdotes and experiences.